Burchell. I'm a scientist at St. Michael's Hospital in the Department of Family and Community Medicine and the Center for Urban Health Solutions, which is part of the Lakashing Knowledge Institute. I'm going to share with you what we're doing in the CTN 275, which is the Enhanced Syphilis Screening among HIV-positive men, or ESSAHM Trial. This is a study that attempts to address the syphilis epidemics that's currently happening among men living in many urban centers across Canada and even globally. Syphilis has really been on the rise for over 10 years now, with rates not declining. In fact, in 2015 in Ontario, there were about 1,000 cases of syphilis diagnosed among men, with about 80% of them among men who have sex with men. And of those, about 40% were men living with HIV. So it's quite a growing problem among men living with HIV. But the good news is, with timely detection of a syphilis infection, it is fully treatable, and you can avoid those health consequences. So with this trial, we're looking at finding a way to have men living with HIV get tested for syphilis more regularly and more often, because studies and models from other places have really suggested that if you make syphilis testing a regular and routine part of sexual health care for men living with HIV, it can really go a long way toward more timely treatment and perhaps less syphilis circulating in the community, because there's less of a chance it'll be transmitted to partners. So with our trial, the idea is to bundle syphilis serology testing with blood work that men are already getting on a regular basis for their HIV care. So on average, men living with HIV are getting viral loads done about every 4 months or so. So our idea is to do the syphilis test with that viral load so that you'd get more men testing for syphilis at least once a year, and the frequency with which they're getting tested will also go up to about 3 tests per year. But most importantly, what the trial is trying to accomplish is to make sure that men, if they get syphilis, are diagnosed in a timely way and get treatment. The way the trial is rolling out is with 4 participating HIV clinics in 4 hospitals in Ontario. In total, there are about 3,400 men who are being followed in this trial, and they're going to be followed for a 30-month period. The way the intervention rolls out is a little bit different from other trials. We're actually randomizing the clinics to begin this change in their practice of ordering blood sets for men living with HIV. And we're doing it in a way that each clinic slowly is randomized to start that new clinic practice. So each clinic will start off in its usual care setup, and one by one they all come on board to implement the intervention. So that intervention is being assigned to clinics rather than to individuals like other trials. By doing this trial, we hope to learn 2 things. The first is it effective in the places where we introduce this intervention? Do we detect more cases of syphilis in a timely way? And the second thing is to find out whether or not, if this intervention is scaled up, could it actually make a dent in the syphilis epidemic among men living with HIV. In closing, I would like to thank the CTN for their support for this study and look forward to sharing the results with you in 2018.